All right, Curtis, I am driving to Montana, so I have 8 hours on the road. And guess what we're doing? We are listening to you for the first 2 hours of it. And for my little assignment here, I'm going to be playing the ABC game. So, whenever I see a sign has an A, I will relate it to something on your lecture. You see, there you are, Module 8, Training and Emergency. Starting off with A in Draper. A correlates to age. Trauma is the number one cause of death for people of the age under 45. Okay, so the next one is B for Bangator. So B is for breathing and airway. Switching around. But you want to make sure they're breathing, because that is the highest priority in getting that airway open by doing a jaw thrust and making sure that they are in a C-spine, so that airway and breathing can maintain open. All right, we're doing C and AC/DC. C is for circulation. So every person that comes in with trauma needs to get intravenous access. If that is impossible, we can do intraosseous, which drills a hole into your bone, which is kind of crazy. But yeah, so during this stuff, you're going to check for warmth, color, pallor, and sensations as well for these people, and get that blood circulating, because we need to have the organs all perfused. And there's a lot of places you can bleed out. D as in daily. I want to eat that chicken daily. So in addition to the ABCs, D correlates with disability. That can be assessed by using the Glasgow Coma Scale and showing what other disabilities they may have that may impede their care. That is what D stands for. E and exit. E is for exposure. You want to get them naked. Get them all exposed and open so you can see what they've been exposed to. See what the other injuries that are on their body that may be usually covered up by clothes. You just want to get a full body assessment on them to see what's going on. All right, then we got F for food. F correlates to flail chest. This is whenever you're breathing, your chest goes in concave. This is a very emergent and serious condition that needs aggressive interventions and surgery. G for glamping. G is for Glasgow Coma Scale. That's one of the best ways to communicate on how somebody is doing. Remember that a higher score means you're doing better, and a low score means that you're doing bad. H in Bass Pro Shop, my favorite store. H is for hypothermia. All the blood goes into your core to stay warm, so it can keep your heart and brain going. But all the cold blood leads to an increase in hydrogen, which turns your blood acidic, so you get a metabolic acidosis. Best way to fix that, give them warm fluids. I in low prices. I is for intubation. It is much easier to intubate somebody when they don't need it than it is to intubate somebody when they do need it, in cases such as like inhalation injury or anaphylactic shock. Okay, so J for Flying J. J is for jewelry. We got to remove some jewelry from people. Sometimes they swell up, and that can cut off blood supply. So that's kind of an overlooked thing, but it's something that's important. So yeah, remove some jewelry. Remove rings, bracelets, tight choker necklaces. Yeah, not good. K is for Maverick. Alright, so K is for kidney injury. Your kidneys can get damaged when there's an excess of blood, and then sometimes whenever things explode inside you, the blood hemolyzes, which can also cause kidney injury. And then also substance abuse and overuse for like overdoses and things. The best thing to treat kidney injury is dialysis and give lots of fluids. L is for land available. Alright, so L is for lavage, such as like gastric lavage or thoracic lavages and stuff like that. And then there's also bladder lavage, which is crazy. And so they're used for different things. Gastric lavage is used for cleaning and getting your stomach pumped. That's what it means, getting all the substances outside of you. The other lavages, such as bladder and thoracic, those are more for hypothermia treatment. That would be getting the body warm by directly pouring warm water and fluids into the body and then having it drain out. So that's L for lavage. Alright, M over there, human since conception. So M is for mass casualty event. These are big disasters and acts of terrorism, but not all disasters are mass casualty events. So the best thing to do is to prioritize your patients by tagging them. Black means they're not going to make it. Red, they need emergent and the most help immediately. Yellow, their treatment can be delayed. And green is like they're walking. They've got like maybe a little cut on their arm or anything like that, but they can be seen after everybody else is stable and okay. And we're going to do N in Tremonton. N is for neurotoxin. That is what the black widow spider does. Not good. We're doing O in Cozy Earth. O is for oxygen. Of course, as always, get people oxygen if their O2 is low, if they're having a hard time breathing, and really important, in drownings. Turn them to their side, so if they cough up water, it doesn't go back into their lungs, and they can get that oxygen to get rid of that hypoxia symptoms. P for Pocatello. P is for perfusion, especially in a mass casualty event. If their pulses are weak and thready, and their capillary refill is greater than 3 seconds, then they are tagged as a red. Q is a massive and a quick response to hemorrhaging protocols. That is getting them stable, getting hooked up to blood, and getting that in them as fast as possible and stopping the bleeding if you can. R in this yummy pastry. R is for rupture. As Curtis said many times, if your heart ruptures, you're a goner. But if your spleen ruptures, or your kidneys, or your liver, you can be saved. The best thing is just really watching that blood volume and that blood and getting that stabilized as much as possible. S for Samaria. S is for snake bite. What you want to do is do not elevate the leg and do not put on a tourniquet. Make sure that you wash the injury very well and then get them to the hospital. What we're watching for is also not to get infection. But then a lot of people don't really get antivenom because some people are allergic to it. And so it's basically just letting the symptoms play out, but it goes away. T is for trucks. So T is for terrorism. They can use chemical, mechanical, and then bio as well. And one of the craziest ones that hasn't happened yet but may in the future is smallpox. They can use that because people aren't vaccinated for it anymore. Basically doesn't exist on the earth, but if it does, then we have to start making new vaccines for it, and that can take some time, so that's pretty dangerous. U in mummies. So U would be for like unstable pelvis fractures. Your bones have a lot of blood in them, and they may look okay on the outside, especially if they've been crushed and stuff like that, but their blood pressure can drop dramatically from bleeding out. V is for lava hot springs. B is for venom. Spiders and snakes both have venom. There's an antidote, it's called antivenom, but a lot of people get sick to it and it kills your kidneys, so it's not given a lot. And they actually don't have poison, these animals, which is interesting. Welcome to Idaho for W. W is for wounds. There are a lot of different wounds that you can get during a trauma, like shearing wounds, which basically like it sounds, shear or rip. And then there's also like dehissing wounds where they come apart just very nice and evenly. There's blunt wounds, and then there's sharp stabbing wounds, and there's lots of different wounds that you can get from trauma. X and exit. X-rays. Yeah, but the X-rays can show us not only like broken bones and stuff like that, but also if there's a lot of bleeding. Bleeding can be hidden within tissues, especially in bone fractures and things like that, and that can show us if there's a lot of blood pooling as well. Kind of like the pelvic fracture that I mentioned earlier. Y in Century High School. Y is for a Y connector. A lot of times these people have either bad veins or shock where their veins aren't accessible, or they just need a lot of things going in all at once. So a Y connector allows you to run blood, medication, saline, fluids, all kinds of things that are compatible all at once to get them fluid resusc. Z for hazmat. So Z was a tough one. Didn't really talk much about that. Anything that had to do with Z, so I had to look something up. But we're talking about penetrating wounds and stuff like that. So there are some that one of the most common areas of the body that get penetrating wounds is actually called the zones on the neck. There are 3 zones. The most common one that gets injured is zone 2, which goes from your jawline to your cricoid cartilage, and that is where most of these penetrating wounds happen. So there you go. That is the ABC game, alphabet game on this road trip with me about trauma. Thanks for getting me through Idaho.